If you're not willing to risk the unusual, you'll have to settle for the ordinary. Kudos to all the freshers for choosing the unusual and arduous path that is still a dream for many.
A very good morning to the dignitaries, parents, teachers and students present here.
I am Ramaswamy from Phase 2 MBBS.
And I am Ahelika from Phase 2 MBBS. It gives us colossal contentment to welcome you all to the inauguration and the White Coat Ceremony for the 18th MBBS batch of Chettinad Hospital and Research Institute.
Chettinad Academy of Research and Education, a deemed to be university, has been contributing significantly to the society as an institute for higher learning and research. CARE has been accredited with grade A++ by NAC, ranked 82nd in the university category and 48th in the medical category by NIRF. Chettinad Hospital and Research Institute is South India's preferred destination for medical education, which is offered on par with high-ranking institutes worldwide.
Words cannot quantify the joy we have to welcome our chief guest for today, Dr. V.V. Bashi, Chairman, Aortic Aneurysm Center, Director, Institute for Cardiac and Aortic Disorders, and Senior Consultant, Cardiothoracic and Vascular Surgeon, SIMS Hospital, Chennai. He is one of the most experienced surgeons in complex aortic aneurysm surgeries and arterial grafting for coronary artery disease in India. Sir, it is an honor to have you with us here today, and we are extremely grateful to you for taking time off from your busy schedule to grace this occasion with your presence. We invite the dignitaries onto the dais. Honorable Vice Chancellor, Chettinad Academy of Research and Education, Professor Dr. R. Sridhar. Esteemed Chief Guest, Dr. V.V. Bashi. Respected Dean, Chettinad Hospital and Research Institute, Professor Dr. N. Meenakshi.
As the saying goes, every good deed begins with a prayer. We now call upon the students of CARE, Samyuha, Nandita, and Achaya to render the prayer song. We request the audience to please rise for the prayer song.
Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Gurume Deva Sarvakaryeshu Sarvada Varavina Mridupani Vanaruhalochanarani Suruchirapam Bharaveni Suranuta Kalyani Nirupama Shubhagunalola Nirata Jaya Pradashila Varada Priya Ranganayaki Vanchita Paladayaki Sarasija Sanajanani Jaya 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 Vani Varavina Mridupani.
Thank you.
As an ode to the conqueror of the dark, the symbol of prosperity, well-being, abundance, and knowledge, we will now have the lamp lighting. We request the dignitaries to light the lamp. We also request 2 student volunteers from the freshers batch to join the dignitaries onto the dais. Thank you. May the light of this lamp illuminate our path and guide us towards knowledge. We request the Vice Chancellor and the Dean to felicitate the Chief Guest with a bouquet and a memento. Thank you.
We have with us today our respected Dean, Professor Dr. N. Meenakshi, a pulmonologist with 40 years of experience as an academician, clinician, and researcher with numerous publications and several funded projects to her name.
We request the Dean, Professor Dr. N. Meenakshi, to deliver the welcome address.
Respected Chief Guest, Professor Dr. Bashi sir, Senior Consultant and Cardiologist and in Advanced Aortic Surgery. Sir, we welcome you for this occasion, sir. Honorable Vice Chancellor, Honorable HODs and faculties from all departments, my dear Registrar, Vice Principal sir, Advisor Balasubramaniam sir, all my students, beloved UG and PG students. A very warm welcome on behalf of Chettinad Hospital and Research Institute and Chettinad Academy of Care and Education. I know I have great pleasure and I am privileged to be here on this occasion. Actually, you all are joined here in this prestigious institution. We welcome you all and your family and your parents also to this occasion. Actually, White Coat Ceremony, as you know, it is a transition from a student to a professional. You are becoming a professional now. You are entering into a medical journey today. But entering into a medical journey involves so much of, it is not just a walkthrough. Actually, it involves so much of difficulties. You will have to undergo so many difficult situations and so many hard situations to become a professional. Your education and graduation won't stop here. You will have to continue. Your graduation will be continuing. Your education will be continuing till I think we'll have to update ourselves. It is not a one-day program. So all of you, I assure you, we'll be all here throughout your journey till the 4.5 years, not only to develop your personal but also your professional development. I request all of you to take care of this opportunity which is given to you and you try to do your best. Only thing I ask for you is be compassionate. Compassionate to the patients because you are their authority. Actually, white coat, it symbolizes purity, honesty, trust, and the confidence that the patients are giving it to you. So you be worth of it. Try to learn as much as you do. And we are giving you opportunities for research also here. Try to utilize these opportunities to the maximum and come out with flying colors. I wish you all a very fulfilling and satisfying career here. Thank you so much.
Thank you, ma'am, for the warm welcome address. The Vice Chancellor of Care, Professor Dr. R. Sridhar, is a renowned pulmonologist and former professor and head, Department of Tuberculosis and Respiratory Medicine, Government Stanley Medical College, and Superintendent of Government Thambaram Tuberculosis Sanatorium. He is known for his kind and compassionate consults and has contributed greatly towards research on asthma, drug-resistant tuberculosis, and HIV. As the superintendent of the Thambaram Sanatorium, he played a very crucial role during the COVID-19 pandemic. He serves on the editorial board of journals like the Journal of Association of Pulmonologists of Tamil Nadu, a simple person who believes in leading by example. We request the Vice Chancellor Care to deliver the presidential address.
Good morning, one and all. அனைவருக்கும் வணக்கம். Respected Chief Guest, Dr. Bashi, renowned cardiothoracic surgeon. Respected Dean, Professor Meenakshi Madam, Registrar Jayendra Saraswati Madam, Vice Principal Arun Kumar, and our academic advisor, Professor Balasubramaniam, head of the departments of all the departments of care. Dear students who have taken up the journey of entering into MBBS and inducted into the 18th batch at CHRA, and dear parents, it's my pleasure and privilege to be part of this august occasion on the 18th batch invocation ceremony and white coat ceremony. I know how much of toil the parents and the students have made so far in the journey to make up to this point. But as pointed out by Madam, this is a beginning. So from here on, you will be learning more and more things in a congenial atmosphere with all the facilities in-house, and our faculty will be there to guide you in the process of learning. தோன்றீர் புகழோடு தோன்றுக அக்திலார் தோன்றலின் தோன்றாமை நன்று என்று திருவள்ளுவர் சொன்னது போல, உங்கள் உழைப்பினால் நீங்கள் எந்த அளவுக்கு உயர முடியும் என்பதை எடுத்துக்காட்டாக நம்முடைய சீஃப் கெஸ்ட் டாக்டர் பாஷி அவர்கள் அமர்ந்திருக்கிறார். அவருடைய திறமைக்கு அவர் வெளிநாட்டிற்கு சென்று நிறைய சம்பாதித்திருக்கலாம். தன்னுடைய திறமை இந்த நாட்டுக்கு பயன்பட வேண்டும் என்று ஒரு ரோல் மாடலாக இருந்து அவர் சாதித்து காட்டியிருக்கிறார். அவருக்கு நம்முடைய நன்றிகளை தெரிவித்துக் கொள்கிறோம். Similarly, we expect all our students who are entering into medicine now today to nurture that knowledge. மனித நேயமுள்ள மக்கள் நலனில் அக்கறை காட்டும் மருத்துவர்களாக அவர்கள் மலர வேண்டும். இதுதான் இந்த செட்டிநாட் அகாடமி ஆஃப் ரிசர்ச் அண்ட் எஜுகேஷனுடைய மோட்டோ. அதற்கு உங்களுக்கு தேவையான அனைத்து நலன்களையும் வசதிகளையும் செய்து கொடுப்பதற்கு திரு சேர்மன் அண்ட் எம்டி திரு MAMR முத்தையா அவர்கள் வேண்டிய பணிகளை செய்து கொடுத்திருக்கிறார். சான்சலர் திருமதி கீதா முத்தையா மேடம் அவர்களும் இதற்கு துணையாக இருந்து பல நல்ல வழிகளை ஏற்படுத்தி கொடுத்திருக்கிறார். கடந்த 2 வருடங்களாக ஒவ்வொரு சப்ஜெக்ட்லேயும் ஃபஸ்ட்டு மார்க் யார் வாங்குகிறாங்களோ அந்த ஸ்டூடெண்ட்ஸுக்கு கேஷ் ப்ரைஸும் கொடுத்து அவங்கள மோட்டிவேட் பண்ணியிருக்காங்க. திருமதி கீதா முத்தையா ப்ரொஃபிஷியன்சி அவார்ட் ஃபார் ஃபஸ்ட் அண்ட் செகண்ட் இயர், as well as Dr. MAMR முத்தையா ப்ரொஃபிஷியன்சி அவார்ட் ஃபார் தேர்ட் அண்ட் ஃபைனல் இயர்ஸ். The second batch of students are going to receive today. So this sort of encouragement is available for our students even during their undergraduation. Not only this, they are having exposure to various skills. Today in the Department of Surgery, there is a training workshop that is going on with the help of Johnson & Johnson, where there is a mobile bus which is training the postgraduates as well as faculty doing endo procedures in-house. So that sort of innovation is happening in the campus, and we have MOU with various other institutions where our students get trained, both undergraduate as well as postgraduate. In addition, we have created an atmosphere for research, clinical research, where the undergraduate students as well as postgraduate students can be part of the clinical research apart from the faculty. We have both intramural as well as extramural funding, for which we have various sources to apply, and then we can get things done. We get ICMR fellowships for doing the research works, and as Madam pointed out, our institution has got a good NAC accreditation as well as NIRF ranking because of these efforts, and we thank the management for all these achievements. With these few words, I wish the batch which has joined today to have a successful education in the undergraduation, to have a good platform for them to branch out to different specialties, to achieve more skills, more laurels, and serve India. Chandrayaan-3 has proved to the world that Indian knowledge is not lagging behind to any part of this world, and we are able to establish ourselves with in-house training. That is most important. So with these few words, I wish the batch every success and have a good, bright future. This institution will help you to achieve those laurels. Thank you very much. Thank you, Honorable.
Thank you, sir.
We call upon Damini of Phase 2 MBBS to introduce our chief guest, Dr. V.V. Bashi, to the gathering.
Good morning, everyone. I am Damni, and I feel immense pleasure in introducing today's chief guest, Dr. V.V. Bashi, a renowned cardiothoracic surgeon, is currently the chairman, Aortic Aneurysm Centre, director, Institute for Cardiac and Aortic Disorders, senior consultant, cardiothoracic and vascular surgeon, SIMS Hospital, Chennai. Hailing from Kerala, Dr. Bashi completed his MBBS from Government Medical College, Kottayam, MS General Surgery from Government Medical College, Trivandrum, and MCH from Christian Medical College, Vellore, followed by FIACS and FACS. Our human body is a wonder, and our heart is a marvel that pumps blood to every single cell in our body to do its work. We know how complex our circulatory system is and how risky and complicated the cardiac surgical procedures are. But our chief guest, Dr. Bashi, is an expert in performing beating heart bypass surgery and a specialist in many other cardiac surgical procedures. Dr. Bashi has an impressive and inspiring experience of 42 years and has completed more than 15,000 surgeries with an overwhelming success rate of more than 98%. He's also described 2 new procedures in the field of aortic surgery. He has worked as a professor at Christian Medical College, Vellore. In fact, he was the youngest professor there. He also served as an adjunct professor at MGR Medical University, Chennai, senior consultant cardiac surgeon at Madras Medical Mission Hospital, Muller Hospitals, and Miyot Hospitals, Chennai. Apart from this, he actively contributes to academics by giving guest lectures, participating in CMEs, and performing surgeries in live surgical workshops. Dr. Bashi has been honored as an invited faculty in numerous symposia across the globe. He's also a member in many prestigious associations and societies, which include Association of Cardiothoracic Surgeons of India and Asia, Society of Thoracic Surgeons of USA, and the European Society of Cardiothoracic Surgeons. He has served as the 51st president of the Indian Association of Cardiovascular Thoracic Surgeons between 2020 and 2021. He has published several articles in various national and international journals. He has received many awards and recognitions, the most notable among them being Lifetime Achievement Awards from the Society of Minimally Invasive Cardiovascular and Thoracic Surgeons of India, from Times Health in the field of cardiothoracic surgery in the year 2022, from AKMG Dubai in 2012, and by Dr. MGR Medical University in 2011. Indo-Australian Award for Meritorious Service for the year 2013. I now request our Honorable Chief Guest, Dr. V.V. Bashi, to address the gathering.
Good morning, everybody. Respected Professor Dr. Sridhar, Vice Chancellor of this university, Dr. Meenakshi, Dean, Registrar, Vice Principal, the Advisor, members of the faculty, students, their parents, senior students and freshers, ladies and gentlemen. Actually, I am speechless standing here, looking at this auditorium and the number of people sitting here. When the Vice Chancellor came to invite me, I never thought I will be facing such a large group of youngsters. And I am very happy that you have invited me. I am very lucky to be here. Thank you very much for your kind invitation. I am privileged to be with you. As you grow older, the companionship of youngsters makes you feel young. That is one of the secrets of our success in working at this age. You are extremely lucky to be in this institution, I must say. Just before I came, the Vice Chancellor, the Dean, and the Vice Principal took me around to the skill lab. I was really taken aback by the facilities you have compared to what we had about half a century before. So you are very lucky to be here to continue your education, because the technology is going to be, there's going to be a big technological outburst in the next 10 to 15 years. So we have to keep up with all those. So I am reminded of to my own personal journey, which has happened. I will just briefly tell you. In 1970, the same year, I was selected for MBBS in Kottayam Medical College, as they mentioned. Before that, I forgot for the generous introduction which you have given me, I don't know whether I deserve everything. But nevertheless, I went to the medical, those days admission, you have to go to the principal with a form. Once you are selected, your name will come in the newspaper. We are waiting for the date when it is going to be announced. So I went to the principal's office, he will sign and give the admission. So you have to go with your father. So I entered the room of the principal and he told us to sit. He asked me, asked my father, what do you do? My father was a farmer. So he told me, I told my father, see, now this fellow is sitting like a cat, is a rat in front of a cat. Okay, after 1 year, he will rise and will start wagging his tail and try to do a lot of things which may lead into trouble, sometimes getting out of the college. You have struggled very hard to put him, to educate him, to bring this level, and he also has worked very hard. So remember, you please tell your son, if you want to do well in life, you be disciplined and look after yourself and you set a goal. So that is number one I have to tell you. You have worked hard to enter this college. Your parents have struggled. Very proud of you entering in this profession, which I consider is one of the noblest. Because if I am asked, what do you want to do in the next my life? I would definitely say I want to serve the people in this medical profession. More so, I want to become a cardiac surgeon again. Because in the last 53 years, I have never regretted even 1 second for becoming in the medical profession. So the story does not end there. To get into medical college, you have to, those days, we have to pass the +2, the present we used to call pre-degree. So I passed my SSLC with honors. I could get any group. Those days, no entrance or nothing. So I wanted to do medicine. Basically, my father also wanted me to do. My grandfather, great-grandfather, all Ayurvedic physicians. Nobody in the modern medicine in my family. So those days to take, you have to take first group, not medicine, second group is biology, third group is commerce. So the class, those days, you want to get a job immediately after that. You become a graduate, you get a job, you take chemistry, easy to get a job, all those things. So my class teacher came to my house and told, you take first group. It is good for you. You get a job immediately. You can earn and have a good living, all those things. But I wanted to do second group. So I got the application form and I filled up everything except the group. Now I'm walking to the college. 3 miles we have to walk. Those days buses and all very less only in our village. There's a college 3 miles away. So during walking, my brother and his 2 classmates were there who didn't get, my elder brother, they didn't get MBBS. They have taken zoology and botany. So they were talking, this boy is also going to spoil his future. He will become just a zoology professor or lecturer. That's it. He's going to spoil. He should not take second group. So I am still in a dilemma as to what to do. So after they left their classes, I went to the principal's office. I take a piece of paper, the application form, put on the wall, write second group. Okay, that is how I joined. That was the turning point in my life, joining second group, then only you can take medicine. So because of the responsibility I took myself, my father has always told, you decide, you are the person who are going to study. You decide what you want to do. So I had to take the responsibility, work very hard. I used to wake up at 3 o'clock, 3:30 to study, bent upon getting a seat in medicine, and I got it. So what I wanted to tell you, second point is, set a goal. Unless you set a high standard for yourself, then only you can climb Mount Everest. There are 2 paths in life. One is the path of ease, other is the path of difficulties. Suppose you see a road which is very smooth. Naturally, you turn the car towards the smooth road. But a irregular road, you will never try to take. But you must understand, a rough road will always lead to a smooth one. It's only initial part only you think it is bad. So I finished my MBBS. Unfortunately, my father developed a terminal gastric cancer. I thought I must stay with my father and look after him. So I opened a clinic. Those days, MBBS doctors are very few. I had tremendous practice, making reasonably good amount of money. That time, post-graduation, I applied for my MS. I got a seat. So I was very reluctant to leave my ailing father and go. So my father called and told me, see, he knew that he had cancer. See, I know I have a problem, but you don't run after little money you're getting now. We used to say in Malayalam, there is a song which we studied in our class, that is, Vittamendinnu martyannu vidya kaivashamavugil vennayundengil narunai verittu karudanamo. That means, what is the need for money if you have education? Education is like butter, and ghee is money. If you have a lot of education, it is always with you. You melt it, just keep it in the fire, you get money. So you go for higher studies, don't worry about me. So that has given me a lot of courage to leave him and go. And within 6 months, he passed away. I completed my MS general surgery. I didn't want to stop there because my father has told you must go as high as possible in your profession and do well. So these are the thoughts of a parent when you are here. That is, your child should do the best, whatever it is. Do the best you can. Do the most you can. And say the least that can be said about it. Don't publicize about it. Reputation is not what you think about yourself. It is what others think about you. You should make others say, oh, so-and-so is a good doctor. And faith, for a patient to have faith in you, it not days, it takes years. Even in true life, faith takes a long time. Even after a long time also, you may not get. Patients has to talk. You should not be talking. Put the patient first when you are seeing a patient, not you. If you start putting you first, that is the beginning of your end. Very important. So, when I joined MCH in cardiothoracic surgery in Vellore, cardiac surgery was very primitive. We have high complications. Coronary bypass surgery was in primitive stage. Results were not good. And I have given letters to patients to go who can afford. It's very difficult, only rich people can go abroad to have bypass surgery or any complex heart surgery. I have given a lot of letters. Those time I took a decision that ever I become a cardiac surgeon and I will to do well, I will go abroad and learn this technology and come back and serve our people who deserve the most from our hands. So I am very happy to tell you that today patients from other countries are coming here to get treated by us in our hospital. It is a very proud moment for me to say that because I wanted that to happen. So I'm very satisfied and a contented person. So then when I went to Australia, when I was there, I was senior registrar. When I finished 3 years of my career, the director of the unit called me and told me, you are so good, why do you want to go to India? I will give you a job. You can work here permanently. I said, no, thank you very much for all you have done for me. I don't want to stay even 1 day extra because I have a bond in CMC that I will go back and serve there. And that is how, what I did. So like your Vice Chancellor said, or your Dean also mentioned, that is, going abroad is always good. You go, I have learned a lot of things. Medicine and whatever it is, you learn in your country because you are treating a different set of people. It's like, the type of patients, the type of diseases, their dietary habits, their climatic things is totally different in other parts of the world because I have worked and seen almost all over the globe. Many countries I have seen. But our people are different. Our culture is different. Diet is different. Climate is different. Our food is different. So it is important. It's like comparing apples and oranges. So now most of the articles, as you come across, you will find are written by people from abroad. All the guidelines we follow, what they have published. So I want you to take it on yourself Because now is the time. You have all the facilities. Everything is there. It is like a puzzle. You have to put everything together, and somebody has to do it because you are the people, the future. We never had any resources or any other facilities because a hospital like this, I will repeat and tell you are very lucky, and utilize the maximum you can from this institution by the time you finish your course. And another thing I want to tell you also, as you go along, you will be getting into clinical practice. It's very important to communicate to patients. Your dean has mentioned, talking to the patient. William Osler, the father of modern medicine, has said, "Doctor, the patient is telling you the diagnosis. You are too busy to listen to him." When somebody comes with a disease, they are, especially when they come with heart disease or advanced disease, they are at their wits' end. A member of their family, it may be the father, it may be their mother, their son, sister, comes with a serious heart problem or a serious disease which has to be cured, they will sometimes fall at your feet. Know what my father told? If somebody falls at your feet, you can do two things. One is you put your feet and stamp him down. Second is to lift him. Lift him from his trouble. That is your job. So, listen to the patient. See, when somebody comes and tell their story, especially nowadays, nobody has time to listen. Before the patient takes 2 words, 100 questions will be asked to him. So he will be coming with so many things. I have no patients coming with a diary, all the blood drip or the blood pressure they will be taking, sugar they will be, a lot of enthusiasm, and them are coming for one, say, year, and they want you to listen. So listen, to be compassionate and empathetic. I had operated on a doctor, a very famous ENT specialist about 20 years ago. He had very high fever after surgery. So one day I went for around 103 fever, he's shivering. I sent with my colleagues. I always carry stethoscope even today. I don't know how many people carry stethoscope. In my unit, I am the only one who carries stethoscope because nowadays technology has changed everything. But connect to the patient, touching the patient, examining him, make him feel that you have taken care of him. So I examined him detail. I myself took his blood pressure. I checked his temperature. I went out of my room and finished. Then I forgot. Patient was discharged. 3 months later when he came, he told me, "Dr. Bashi, when I was sick, I was delirious. I didn't know what you did. The day you came and examined me and talked to me and told me everything will be all right. After he went out of my room, I felt something has gone out of my body. I felt so relaxed, I felt so nice, and afterwards I was feeling so well. I didn't want to tell you before discharge, this is what I felt." Even now, when I see patients, because I have patients from neighboring states everywhere, patients come to see me. A lot of patients, when I take the chart and look at the papers, okay, everything is okay, blood sugar is okay, ECG is echo. Some patients say, "Sir, please just examine me. Put your stethoscope on my chest. Just hold my hand and pulse." I come here only for that. 1 year if you do that, next 1 year I'm absolutely fine. I am telling from my experience. So many patients have told me that. They don't like me just holding the X-ray and say it is fine. They want that touch, physical touch. Whatever may be the technology, artificial intelligence, skill lab, everything will come in the future. But we are all basically human beings with emotion, with attachment to others, and care when you are sick. Caring is different from care. You have to be caring for the patient and listen to them, because that is a very, very important quality. If a doctor has to be a good human being first, then only a doctor. Those who are a good human being, he understands the problem of another human being. So now I will go back a little bit about our ancient system. In the Vedas, what they have said. The Sanskrit sloga, I will say. The importance of the profession. That is in Vedas, in Atharva Veda, it is written like, I will translate it, Kujit Maitri, Kujit Dharma, Kujit Vittam, Kujit Yasha, Karmabhyasa, Kujit Chova, Chikilsa Nastu Nirmala. That means, these are the moral obligations that medical students need to keep. It is said in the Vedas, remind you, in mind when you join the profession. For the success of the profession, you must be aware of your moral commitments. The ethical background that medical students have to remember is his or her personal responsibility for the welfare of the society and not merely for personal sustenance or livelihood. You have to improve the society. That is a social commitment as a doctor you have got. You have got a lot of friends, relatives. They become friends. They want to treat you. So slowly you become famous. Okay, if you go to so-and-so doctor, he will take care of you. That news spread only slowly, but it will spread. Like what I said, the reputation keep coming. Like I always say, if I look after 100 patients, look after them, operate and do well, they will say, okay, you go to the doctor, he is good. But if one patient dies, they will prevent 100 people from coming to us. That is the state today. So it is important that you should keep in mind all this. And also, you need a good professional knowledge. So, when the first hospital, before the hospital name was coined, in Germany, there is a place where patients were treated. The hospital name is, you know what was written there? Whoever comes here will be treated with love and care and respect. So, the implantation of love in a human being is called medicine. That is what Plato has said. So, Hippocrates, in his first aphorism, has said, where there is love for mankind, there is love for the art of medicine. Same Frank Payne in the 18th century mentioned that basic of medicine is sympathy and desire, empathy and desire to help others. So, just sympathy alone is not enough. That is what Hippocrates said. The doctor should be well versed in his profession, capable of tackling difficult situations. You should have the knowledge. For that, what you have to do, you should have a theoretical knowledge. Just by showing sympathy is not enough. They are not going to come to you. You have the knowledge. What is his disease? How much I have diagnosed? What treatment I have given? If he does not respond to your treatment, patient is not going to come, especially today. Olden days, MBBS doctor and all was a dream for us to see. In my whole village, there was only one MBBS doctor. To get him, you have to stand in queue from morning till evening to see him. Now, it is the other way around. Doctors are standing to get patients. It is reversed. We have got doctor in every family, every nook and corner. So, you have to strive for excellence. Then only you can survive. So, how to become good? You have to keep on working hard. So, in Charaka and Sushruta, in their writing, they have said that successful management of suffering patients requires a balance of 4 entities. That is in Charaka Samhita. Charaka Samhita is a Sanskrit of Ayurveda. This I learned all from my grandfather only. That's why I've written. I'm not a big Sanskrit scholar. But I used to talk to my grandfather when I was young. As a medical student, I used to go and sit on his bedside. So he used to tell me a lot of things which I used to take it very silly like that. Okay, what is he talking? A lot of philosophy. I am only, say, 15 years old. So one of the things he told me when I went to his house was there was a mango tree, a small tree. It was full of mangoes. So the branch is almost bent and it is almost touching the ground. So he told me, in life you should be like that. The higher you go, your head should touch the ground. If there is no fruit, where there is no fruit on the tree, the branches are always up only. So it's so important that you should have that attitude. Oh, I am the best. Without me, nothing will happen. Nothing is, nobody is going to, the world is not going to stop. It's like, imagine the world considered as a huge swimming pool. Okay, you enter into the pool, you make a lot of froth, spill water, you backstab others, you want to be the best. You come out of the pool, the water goes to the same level. What was there before you entered, the water is at the same level. The world is like that. You have come into this world, you did a lot of things, you are the best, you treat your colleagues not well, in the family you fight for property, everything, money, everything. You die one day, you are only a custodian of what you have. You have crores of rupees in the bank, so all will be lying there. But what you have done to a fellow human being, how considerate you was to another person, how have you treated your relatives, your colleagues, that is what makes you what you are. Only thing you leave in this world is your name. So and so, after you die, somebody should say, so and so doctor he was a nice person. He was caring. Caring is different from care, I've told you before. You have to be caring for others. That is the most important thing you have in this profession. You cannot get any other profession where you can have this particular thing to give others when they are in trouble. So another thing also, what Charaka has said that the management of a suffering patient requires the balance of 4 entities: the doctor, patient, medicine, and attendants. Ancient forefathers of medicine stated that patient should be a Nyabaka. Nyabaka means he should be educated, that I told you before. The relatives also, you have to talk to them. Nowadays, it is very hard. I was telling your Vice Chancellor, I spend more time in talking to the patient and convincing them and the relatives when a patient comes for an operation, more time than doing the operation. Doing the operation is my job. Every day we do that. So, but you cannot get impatient and say that, it is not my job. When you become sick only you realize. So what I tell my colleagues, when a patient comes to you, patient is sitting opposite to you, I am sitting on this side. You immediately change your position. You think they are sitting that side. And the doctor is this side. Okay? So what all things a patient comes, his problems, you exchange the seats. So you listen to that, to the patient's symptoms and struggles. So you will be a better person tomorrow. The next thing is, we have to document. Documentation, publish, like publications they were reading. That is, unless you write, you have to do research. You should be able to spend some time on academic front to publish. Because if you don't, there is one famous editor of the journal has front of the editorial it is written here, that is, publish or perish. So how do you acquire knowledge? Suppose I have done something, I will write and publish in a journal. You go and read it. You do something. That is how medicine has progressed over the years. So that is also part of your job, because nowadays there is a lot of opportunities for learning, because knowledge is in your fingertips. Electronic media, so much. Olden days, to get a journal in 1980, we have to wait till 1981. That also comes in a ship only. There is no airmail and all. It's very expensive to journal from abroad. Now today, when operation is done in the US, next time you will put in the thing and you will just, you are able to see that. So change in medicine, always it is happening. When a new thing occurs, not many people accept. The first thing is to just to reject it. Very few people only accept. Some people don't even bother about it. So change always will be good only for the better thing. When the first coronary angioplasty was done, everybody thought it is not going to happen. Surgeons were laughing, okay, what is it going to happen? Now, the angioplasty is, everybody knows about it. Even layman knows about angioplasty, stenting and everything. It is so common. People are not willing to accept it. When the first kidney transplant was done, after death of about 40 patients, only one was successful. But they insisted on doing it. Perseverance. Whatever it is, I will achieve. I am not going to give up. That attitude, that's called the killer instinct. I will not give up. I am trying to do the best. There is no, what is my explanation of impossible? I am stands, I will make it possible. There is nothing impossible in my dictionary. You can climb Mount Everest if you want. So don't think about nothing is impossible. Everything is possible, provided you put your heart and soul. It's very hard. So you have got a golden opportunity. So the publications and communication will make you slowly, because when you apply for jobs, other parts of the world, they may ask for your publications. When I get a job request from people, most of them will be writing, okay, I'm a member of such club, actively interested in sports, used to get this thing, there won't be any scientific thing in that biodata. So if you have a good biodata, you can get a job anywhere. They will consider you in a very good state so that you can apply, learn. I'm not telling you should not go anywhere outside. You should go, learn new things. Medicine you learn, but different lifestyle you see, so many things you become a better person. Treating the fellow human beings is very important. And importance of a teamwork. Your doctor always, he has to be a leader. You may have to be a teacher. You may have to head a team. You have subordinates. You treat them well so that they stay with you. As you become senior, you will have more people. So I will stop my talk with a small story of a carpenter. I don't know whether you have heard about it. There was a brilliant carpenter who used to amazingly construct houses. And he was serving his master for many years. One day he went and told his boss, sir, I have served you for almost 40 years. Now it is time for me to retire. So he told, he's an amazing person. Why do you want to retire? But before you retire, I want you to construct one more house. So the carpenter was not very happy. He said, sir, I want to spend time with my wife and children. If possible, don't allocate me that job. Okay, but since his boss said he could not say no, so somehow we managed to build a house with all the things available. He didn't look for any expensive things or with the state-of-the-art things which we construct. Normally he constructs amazingly, use the best things and construct the house. So usually what is the procedure as after the house is constructed, his boss come and inspect the house. And he say, okay, everything is fine, all those things is ready, we can sell this house. That's what happened. So in this house, his boss as usual came. He gave the carpenter gave the key to his boss. So the boss, what he did was, he took the key and gave it to him. This is your house. This is the reward I'm giving you for working with me for so many years. This is your own house. You stay in this house for the rest of your life. So the carpenter felt very bad. I could have built this house with gold. I could have used the best things in this house. But I didn't do that. So I have to live in this house which I have constructed. So if you want to live in a house which is good, you have to do it. It has to come from within. Whatever you do, every brick you place, every window you do has to be the best, so that the rest of your life you can live happily in that house. Thank you very much for this wonderful opportunity, and thank you for listening to me. Wish you all the best. Work hard and do well. Okay? That is my advice. There is no substitute for monotonous hard work, which was said by our father of the nation, Mahatma Gandhi. No substitute for monotonous hard work. And hard work never kills anybody. If you don't work hard, people have died. Nobody has died of hard work.
Thank you, sir, for your inspirational speech. You reminisced about your journey in the medical profession and the importance of the wealth of knowledge. We salute your decision to stay back in our country to serve our people, and I'm sure that all of us are inspired to follow your path of hard work and discipline.
We are sure that we will be compassionate, caring, and empathetic to our patients and wholeheartedly listen to them.
We will now be having the prize distribution ceremony for the MBBS toppers in the university exams. This will be coordinated by Rohit and Adara of Phase 2 MBBS.
A very good morning to the gathering. I'm Rohit.
And I'm Adra from Phase 2 MBBS.
We will now be presenting the subject toppers in the university examinations conducted for MBBS Phase 1, 2 and final year Part 1 and 2.
The winners will receive a cash prize of Rs 50,000 per subject. We request the dignitaries to give away the ceremonial checks to the toppers.
We also request the students to come on stage when their names are called.
From Phase 1 MBBS, the subject topper for anatomy and physiology is Mohammad Nawaz N. Please cheer up the winners, guys. For biochemistry, the topper is Avantika Kasi Viswanathan. The prize will be received by Anju on her behalf.
Moving on to Phase 2, Rubeshwari S is the topper for 2 subjects, pathology and microbiology. Please give her a big round of applause. The prize for pharmacology goes to Akshay A.
From final year MBBS Part 1, the subject topper for forensic medicine is Hema Priya T.
We request Hema Priya to stay back on stage.
Hema Priya T is sharing the prize for ENT with Shifa S. Please give them a big round of applause. In ophthalmology, Harshika Jagrup Singh is the topper. Bhuvi Sharma gets the prize for community medicine.
Now for final year MBBS Part 2, the topper for medicine is Tina Kezi Angel A. Aditi R has won the prize for surgery. Jaffrey Mickelson T has topped in obstetrics and gynecology. For pediatrics, it is Gayatri V.
Gayatri was also the topper in 3 subjects in second year MBBS and the batch topper in pre-final year. She has also been qualified to receive the SK Sarin Gold Medal for medicine.
She has been triumphant in sports too, where she has been the volleyball captain and has won 11 trophies for our college. Under her captaincy, our team has also won the Kabaddi Trophy. Please give her a big round of applause.
We thank the dignitaries for giving out the prizes and heartily congratulate the toppers.
Thank you.
Thank you, Rohit and Adra. We're sure that the prize distribution ceremony will motivate and inspire the freshers to win many laurels and attain greater heights.
I earnestly congratulate my fellow medical friends on selecting one of the best medical colleges in Tamil Nadu. It is a fact that we have a dynamic management, devoted and motivating teachers, beautiful environment and the best infrastructure. Now here we have Rahul Darshan, Kavan Nelavan and Achaya of Phase 2 MBBS to talk about their experiences at Chettinad.
Good morning to the dignitaries present on the dais, to the respected teachers, parents and students. Congratulations guys. கஷ்டப்பட்டு நீட்லாம் முடிச்சுட்டு காலேஜில் ஜாலியாக இருக்கலாம்னு வந்திருப்பீங்க. வீட்டில் கூட சொல்லியிருப்பாங்க 10th முடிச்சுட்டு ஜாலியாக இருக்கலாம், 12th முடிச்சுட்டு ஜாலியாக இருக்கலாம், நீட் மட்டும் முடிச்சுட்டு கண்டிப்பாக ஜாலியாக இருக்கலான்னு. ஆனால் உண்மையை சொல்ல போனால் இனிமேல் தான் கேமே ஸ்டார்ட் ஆகுது. ஸோ செட்டிநாடு வந்து எதுவாக இருந்தாலும் கொஞ்சம் டிஃப்ரெண்ட்டாக தான் பண்ணுவாங்க. ஃபார் எக்ஸாம்பிள் நம்ம காலேஜ் பற்றி பேச தான் என்னை கூப்பிட்டாங்க. அவங்க நினச்சிருந்தா யாரோ ஒரு ஸ்டூடெண்ட்டை கூப்பிட்டு யாருக்கும் புரியாத மாதிரி ஒரு ஸ்பீச் கொடுப்பான்னு சொல்லி முடிச்சிருக்கலாம். ஆனால் என்னை கூப்பிட்டு காலேஜ் ஜாயின் பண்ணுறவங்க முன்னாடியே வந்து காலேஜை கலாய்க்க சொல்லியிருக்காங்க. இந்த மாதிரி ஆப்பர்ச்சுனிட்டிஸ்லாம் எங்கே கிடைக்கும்? நம்ம காலேஜில் தான் கிடைக்கும். ஸோ வெல்கம் டு செட்டிநாடு. காலேஜில் ஃபஸ்ட் கிளாஸே அனாட்டமி டிசெக்ஷன் தான். 8:30க்குலாம் ஸ்டார்ட் ஆகிடும். ஸோ நீயும் சின்சியராக 5:30லாம் எழுந்திரிச்சு அடிச்சு பிடிச்சி கிளம்பி பஸ் பிடிச்சி காலேஜ் வரதுக்குள்ளே 8:30 ஆகிடும். அனாட்டமி டிசெக்ஷன் காலுக்கும் பஸ் நிற்கிற இடத்துக்கும் 1 கிலோமீட்டர் நடுவில் தூரம் இருக்கும். ஸோ நீயும் ஓடுவேன். போகிற வழியிலேயே இந்தியா பாகிஸ்தான் பார்டர் செக்யூரிட்டி மாதிரி 4 கேட் இருக்கும். அங்கே உனக்கு முன்னாடி 40 பேர் நின்றுட்டுருப்பான். அதையும் தாண்டி மெயின் பிளாக் போனோன்னா பாம்பு ஸ்குவாட் நிற்பாங்க. கையில் 2 மிஷினு, சைடில் 2 சென்சார். பாம்பு வச்சிருக்கானு செக் பண்ணுறதுக்காக இல்லை, ஃபோன் வச்சிருக்கானு செக் பண்ணுறதுக்காக தான். அங்கே ஹிந்தி பையன் வந்து போயிட்டு நான் நஹி பையா ஃபோன் நஹி பையான்னு சொல்லுவேன். அவர் தமிழ் நஹி மாலும் சொல்லிட்டு செக் பண்ணிட்டே தான் இருப்பார். இத்தனையே தாண்டி கிளாஸ் போயிட்டு உட்காரலான்னு பார்ப்பேன். வாய்ப்பில்லை ராஜா. டிசெக்ஷன் சொல்லிட்டு 2 மணி நேரம் நிற்க வைப்பாங்க. இப்போவே வீட்டுக்கு ஓடிடலான்னு தோணிடும். பட் கேடவெல்லாம் டிசெக்ட் பண்ணும்போது ரொம்ப இன்ட்ரெஸ்டிங்காக இருக்கும். லெக்சரெல்லாம் ரொம்ப பெருசாக ஸ்பேஷியஸாக இருக்கும். ஸோ யாரும் பார்க்க மாட்டாங்க, ஃபோன் யூஸ் பண்ணலாம்னு நினைப்பீங்க. டக்குன்னு 4-5 பேர் சிபிஐ ஆஃபீஸர்ஸ் மாதிரி வந்து ஒன்று பிடிச்சிருவாங்க. எப்படிறான்னு கேட்டால் அந்த ஓரத்தில் இருக்கிற அந்த கேமராவில் இந்த ஆங்கிள்லேருந்து நாங்கள் பார்க்கும்போது நீ மாட்டிக்கிட்டப்பான்ருவாங்க. அந்த ஒரு ஆங்கிளையும் 50 இன்ச் டிவி வச்சு 10 பேர் 10 வாட்டி பார்த்துட்டு இருப்பாங்க. சில டைம் பார்டர் கிராசிங்லாம் பண்ணுவாங்க நம்ம பசங்க. ஹாஸ்டல் பசங்க பஞ்ச் அடிச்சுட்டு காலேஜ் விட்டு வெளியே போக முடியாது. ஸோ டேஸ் காலர் பையன் பஞ்சில் போகலான்னு பார்ப்பாங்க. பையனும் போயிடுவான். அப்பா அடி தப்பிச்சாச்சுன்னு நினைப்பான். கேமரா பாருங்கள், ஸ்மைல் பண்ணுங்கள். அதே 50 இன்ச் டிவி, அதே 10 பேர் உங்களை பிடிச்சிருவாங்க. கமலஹாசன் மாதிரியே நம்ம ஆஃபீஸர்ஸ் வந்து குறும்படம் போட்டு காமிச்சிருவாங்க. லைப்ரரின்னு ஒன்று இருக்கும், சூப்பராக இருக்கும். இருக்கிற படிப்ஸ்லாம் உள்ளதாக இருக்கும். அதனால் அதை பற்றி எனக்கு எதுவும் தெரியாது. நம்ம காலேஜ் பற்றி இன்னும் உங்களுக்கு புரியல. சும்மா காரிடாரில் நடந்து போய்ட்டுருப்பீங்க. டக்குன்னு சார் வந்து மூஞ்சில் என்னப்பா ஏதோ இருக்குது சார், பியர்ட் சார், ஏதோ பின்னாடி தொங்குதே சார், ஹேர் ஸ்டைல் சார், ஃபங்க் வச்சுருக்கேன், வலிச்சிரு. அப்படியே போகிற வழியில் 10,000 ஃபைனும் கட்டிட்டு போய்ட்டுருவார். நான் மாட்டுக்கு 7 தானே இருந்தேன். அடுத்த நாளே பையன் மொட்டை ராஜேந்திர மாதிரி ஆகிடுவான். வாவ் வெரி க்ரீன், வாவ் எஸ்கலேட்டர், வாவ் எலிவேட்டர் அப்படின்னு தானே வந்தேன். நானும் அப்படி தான் வந்தேன். நாங்கள் இப்போ இன்னொன்று சொல்ல மாட்டேன்ட்டேன். ஸ்கில்ஸ் லேப் பற்றி சொல்லணும். நிறைய திங்ஸ் இருக்கும். ஸ்கில்ஸ் லேப் ரொம்ப சூப்பராக இருக்கும். நிறைய திங்ஸ் இருக்கும், நிறையா உள்ளே வச்சுருப்பாங்க. நாங்களே இன்னும் ஃபுல்லாக பார்த்தது இல்லை. அவ்வளோ ப்ரொடக்டிவாக வச்சுருப்பாங்க. சவுத் ஏஷியாஸ் பிக்கஸ்ட் சிமுலேஷன் சென்டர் வித் ஸ்டேட் ஆஃப் தி ஆர்ட் ஃபெசிலிட்டிஸ். என்ன வேணாலும் கலாச்சிக்கோ, நான் ஸ்கில்ஸ் லேப் பற்றி மட்டும் கரெக்டாக சொல்லுன்னு சொன்னாங்க. அதான் நான் சொல்லிட்டேன். இயர் ஃபுல்லாக அவங்களை டார்ச்சர் பண்ணதுக்காக ஒரு 4 days ஃப்ரீயாக விடுவாங்க ஃபார் செட் ஃபெஸ்ட். கல்ச்சரல் ஈவெண்ட்ஸ்லாம் இந்த ஆடிட்டோரியம் தான் நடக்கும். அப்போது உங்களை காலேஜ் கலாய்க்கு ஆப்பர்ச்சுனிட்டி கொடுப்பாங்க. யாரும் மிஸ் பண்ணாதீங்க, அழகாக யூஸ் பண்ணிக்கோங்க. கேம்பஸ் ஃபுல்லாக கேமரா வச்சுட்டு கொஞ்சம் எக்ஸ்ட்ரா கேமரா இருந்திருக்கும் போல் தூக்கி பஸ்லேயும் வச்சுட்டாங்க. பஸ்லேயே இருந்து இறங்கி ஃப்ரெண்ட்ஸ் கூட எங்கேயாவது வெளியே போகலான்னு பார்த்தீங்கன்னா பஸ் வரத்துக்கு முன்னாடி எஸ்டிமேட்டட் டைம் ஆஃப் அரைவல் 5 minutes 10 minutes வீட்டுக்கு மெசேஜ் போயிடும். டார்கெட் டைம் வச்சு ஃபுட் டெலிவரி பண்ணுற மாதிரி டைமிங்கு உங்கள் பசங்களை டெலிவரி பண்ணுறாங்க. ஒரு பிரச்சனையும் வராது. பஸ்ஸு விட்டு இறங்கிறதுக்குள்ளே வீட்டிலேருந்து ஃபோன் வந்துடும். பேரண்ட்ஸ்லாம் அவங்க கிட்ஸை காலேஜ் அனுப்புறப்போ ஒரு பயம் இருக்கும். அந்த பயம் உங்களுக்கு இங்கே வேணாம். நீங்கள் இன்னொரு ஸ்கூலில் தான் சேர்த்து விட்டுருக்கீங்க. பட் ஜோக்ஸ் அப்பார்ட், இட்ஸ் a very good college. Faculties are very friendly. They make sure we understand the concepts. The campus is very welcoming, pollution-free and clean. MBBS is a very harsh and tough course and it requires immense training, dedication and discipline. Chettinad makes sure each and every one of us turn out to be a great doctor with all these principles and rules. பயமா இருக்கா? ஹாஸ்டல் பற்றி கேளுங்க, இன்னும் பயங்கரமாக இருக்கும். I call upon Kavin 11 to share about his experience in Chettinad Hostel. Thank you.
கிட்டத்தட்ட ஒரு 2 வருஷத்துக்கு முன்னாடி நான் உட்காந்துருந்த மாதிரி இருக்கீங்களேடா. சரி, நம்ம ஃபேக்கல்ட்டிலேருந்து ஸ்டார்ட் பண்ணுவோம். நம்ம காலேஜோட ஃபேக்கல்ட்டி பற்றி சொல்லணும்னா ரகங்கள் பலவிதம், அதில் ஒவ்வொன்றும் உலகத்தரம்னு ஒரு டிபார்ட்மெண்ட்லேயும் ஒரு டைப்பான ஃபேக்கல்ட்டி. அதுலேயும் நம்ம விபி சார்லாம் செம்ம ஃப்ரெண்ட்லி. எவ்வளோ ஃப்ரெண்ட்லினா ஜாலியாக நம்ம தோல் மேலே கை போட்டு பேசிக்கிட்டே தான் வருவார். ஆனால் அவர் என்ன பேசுகிறாரு நமக்கும் அவருக்கு மட்டும்தான் தெரியும். அதுக்குன்னு அவ்வளோ ஃப்ரெண்ட்லியா அப்படின்லாம் கேட்காதீங்க. அவரோட சப்ஜெக்ட்னு ஒன்று இருக்குது, பேர் ஃபார்மகாலஜி. அதில் ஒரு டெஸ்ட்டில் ஒரு பீரியட் கூட பங்க் அடிக்க முடியாது. அதெல்லாம் சார் வேறு மாதிரி. அப்படியே அகாடமிக்ஸ் பற்றி பார்ப்போம். அகாடமிக்ஸ் பற்றி சொல்லணும்னா நம்ம ராகுல் தர்ஷன் சொன்ன மாதிரி இது ஒரு ஸ்கூல் தான். என்ன தான் நீங்கள் 250 பேர் ஒரு பேட்ச்னு அட்மிஷன் போட்டாலும் ஒரு கிளாஸும் 50 பேராக தான் பிரித்து எடுப்பாங்க. அதுக்கு பேர் தான் எஸ்ஜிடி, அதாவது ஸ்மால் குரூப் டீச்சிங். இது இல்லாமல் ஒரு சப்ஜெக்ட்லேயும் ஒரு 30 பேருக்கு மென்டார்னு ஒருத்தவங்க இருப்பாங்க. அவங்கள அசைன் பண்ணது என்னமோ நம்மள சப்ஜெக்ட் சொல்லித்தரதான். ஆனால் நம்ம சொல்கிற சொந்த கதை, சோக கதை, வீட்டு பிரச்சனை, வாழ்க்கை பிரச்சனை எல்லாத்தையும் அவங்க கேட்பாங்க. இதோடு இல்லாமல் இயர் ரெண்டில் இவன் எவ்வளோ படிச்சிருக்கான், நம்ம ஒன்றுமே படிச்சிருக்க மாட்டோம், இருந்தாலும் இவனை என்ன படிக்க வைக்கணும், எப்படி படிக்க வைக்கணும், எதை வச்சு படிக்க வைக்கணும்னு நம்மள பாஸ் பண்ண வைக்கிறதுக்குள்ள அவங்க படுற பாடு இருக்கே எப்பா. காலேஜ் ஸ்டார்ட் ஆகும்போது நம்மளும் புக் வாங்குவோம். எது கைட்டன்லேருந்து கெனாங் வரைக்கும், ராபின்ஸ்லேருந்து ராம்தாஸ் வரைக்கும், திரிபாத்திலேருந்து தாரா வரைக்கும். பட் இயர் ரெண்டை நம்மளை எது காப்பாற்றுன்னு கேட்டால் எல்எம்எஸ் தான். எல்எம்எஸ்ஸா அப்படின்னா என்னன்னு கேட்குறீங்களா? இவ்வளோ புக்கு படித்து மண்டையில் ஏறாதது நம்ம ஃபேக்கல்ட்டி எடுத்த பிபிடி பார்த்த உடனே புரியும். அதெல்லாம் அப்லோட் பண்ணி வைக்கிற இடம் தான் எல்எம்எஸ். அப்படியே நம்ம ஹாஸ்டலுக்கு போவோம், அதாவது பாய்ஸ் ஹாஸ்டல். பாய்ஸ் ஹாஸ்டல்னு பார்த்தா மொத்தம் 4 பிளாக்குக்கு ஒரு வார்டன்னு மொத்தம் 4 வார்டன். இவங்க இல்லாமல் சீஃப் வார்டன் ஒருத்தர் இருக்கார். சீஃப் வார்டன் அவர்லாம் வந்தார்னா ஈவினிங்கில் செம்மையாக கதை சொல்லுவார். அதுவும் ஸ்பெஷலாக ஃப்ரெஷர்ஸ்க்கு. கதையா என்ன, காக்கா கதை குருவி கதையா அப்படின்னு கேட்குறீங்களா? அதெல்லாம் கிடையாது. அவரோட சர்ஜிக்கல் எக்ஸ்பீரியன்ஸ், லைஃப் எக்ஸ்பீரியன்ஸ் அதெல்லாம் சொல்லுவார். எல்லா கதையும் செம்மையாக இருக்கும். அவராக சொல்லலாம், நீங்களாம் பிடிச்சி கேட்டுங்க. அப்புறம் பேரண்ட்ஸ்லாம் ரேகிங் பற்றி பயப்படாதீங்கப்பா. ஜூனியர்ஸை வந்து எங்கள் கண்ணில் கூட காட்ட மாட்டாங்க. அவங்களுக்கு வேறு பிளாக்கு, எங்களுக்கு வேறு பிளாக்கு, அவங்களுக்கு வேறு ஃபுட் டைமிங், எங்களுக்கு வேறு ஃபுட் டைமிங். ஸோ எங்கே பார்த்துக்கிறது, எங்கே இன்ட்ராக்ட்லாம் வாய்ப்பே இல்லை. நெக்ஸ்ட்டு அப்புறம் வந்து ஒரு மெயின் மேட்ரு சொல்லவே மறந்துட்டேன். நம்ம ஹாஸ்டலோட ஹைலைட்டே சேஃப்டி தான். எவ்வளோ சேஃப்னா ஈவினிங் 6:30க்கு பூட்டுற கேட்ட மறுநாள் காலைல 6:30க்கு தான் திறப்பாங்க. நீ டெயில் கேட்டிங்கில் கூட தப்பிச்சிடலாம், ஆனால் இதில் தப்பிக்கவே முடியாது கண்ணா. பட் எனிவேஸ் உள்ளே சும்மா இல்லைடா. ஸ்விம்மிங் பூல் வேணுமா, ஸ்விம்மிங் பூல் இருக்குது. ஜிம் வேணுமா, ஜிம் இருக்குது. இண்டோர் வேணுமா, இண்டோர் இருக்குது. பேஸ்கெட் பால் கோர்ட்டை வேணுமா, பேஸ்கெட் பால் கோர்ட் இருக்குது. பேட்மிண்டன் கோர்ட் வேணுமா, அதுவும் இருக்குது. எல்லாத்துக்கும் மேலே ஃப்ரீ ஒய்ஃபை 24/7 இருக்குது. பட் அது அப்பப்போ வேலை செய்யாது, அப்போ மட்டும் டேட்டா வச்சு அட்ஜஸ்ட் பண்ணிக்கோங்கடா. எனிவேஸ் கேர்ள்ஸ் ஹாஸ்டல் பற்றி என்ன கேட்டால் எனக்கு பர்சனலாக ஒன்றும் தெரியாதுப்பா. ஏன்னா நம்ம காலேஜில் என்னெல்லாம் அந்த பக்கம் போக விட்றதே இல்லை. ஸோ அதை பற்றி பேச வராங்க நம்ம அட்சயா.
அதாவது எங்கேருந்து ஸ்டார்ட் பண்ணுறதுனே கன்ஃபியூஷனாக இருக்குது. சரி, குத்து மதிப்பாக ஆரம்பிப்போம். ஃபஸ்ட்டு அட்டண்டன்ஸ். நீங்கள் என்ன பண்ணிகிட்டு இருந்தாலும் ஷார்ப்பாக மார்னிங் 7க்கும் நைட் 9க்கும் கன்ஃபார்ம் அட்டண்டன்ஸ் கொடுத்துடணும். அப்படி நீங்கள் நைட் லேட்டாக தூங்கி மார்னிங் எந்திரிக்க முடியாமல் போச்சுன்னா உங்களுக்கு பெர்மிஷன்லாம் இல்லை, கண்டிப்பாக அட்டண்டன்ஸ் கொடுக்கணும். கொடுக்கலனா உங்கள் ரூம் பூட்டப்படும். திறக்கணுன்னா நீங்கள் சீஃப் வார்டன் தான்ப்பா பார்க்கணும். இதாவது ஓகே, சம்டைம்ஸ் பாய்ஸ் புலம்புவாங்க ஸ்ட்ரிக்டாக இருக்குன்னு. அப்படிலாம் இல்லை, அவங்களாவது 6க்குள்ளே எங்கேயாவது வெளியே போயிட்டு வரலாம். ஆனால் நமக்கு அப்படி இல்லை. ஹாஸ்டல் விட்டால் காலேஜ், காலேஜ் விட்டால் ஹாஸ்டல். இந்த சைக்கிளை பிரேக் பண்ணலான்னு நீங்கள் 4 to 6 எங்கேயாவது வெளியில் போயிட்டு வரலான்னு போயிடுவீங்க. போயிட்டு கூட வந்துடுவீங்க. வந்ததுக்கப்புறம் மாட்டிக்கிட்டா சமாளிக்கிறதுக்கு ஸ்நாக்ஸ் சாப்பிட போகணும், ஜூஸ் குடிக்க போகணும்னு சொல்லுவீங்க. அந்த பருப்பெல்லாம் இங்கே வேகாதுப்பா. என்ன அதனாலே என்னமோ தெரில, நம்ம மெஸ்ஸிலேயே பானிபூரி, ஜூஸு, ஸ்நாக்ஸு எல்லாம் கொடுக்க ஆரம்பிச்சிட்டாங்க. பேரண்ட்ஸ் யாரும் பயப்பட வேணாம், உங்கள் பிள்ளைங்க எங்கேயாவது வெளியில் போய் தொலைஞ்சிருவாங்கன்னு. இங்கேருந்து வெளியில் போகணும்னா 7 கடல் 7 மலை தாண்டி போகிற மாதிரி லெட்டர் எழுதி சீஃப் வார்டன்ட்ட சைன் வாங்கி பேரண்ட்ஸ் வந்து பேரண்ட்ஸ் மெயில் போட்டு மைகேட் நம்பர் கொடுத்து அப்பப்பா அதுக்கு ஹாஸ்டல்லே தூங்கிடலான் இருக்கும். கர்ணனுக்கு கவச கொண்டுள்ள மாதிரி நமக்கு இந்த ஐடி கார்டு. அது இல்லைன்னா உங்களால் வெளியிலையும் போக முடியாது, உள்ளேயும் வர முடியாது. உங்களுக்கு எங்கே போனாலும் காலேஜ்குள்ளே ஐடி கார்டு முக்கியம் பிகிலு. அப்புறம் கேர்ள்ஸ் கலராக ட்ரெஸ் போட்டு காலேஜுக்கு வரலான்னு பார்த்தா இல்லைப்பா, உங்களுக்கு யூனிஃபார்ம் கொடுப்பாங்க, அதுதான் போடணும். இன்டர்ன்ஷிப் அப்போது நைட் டியூட்டிஸ் இருக்கும். அதோட சேஃப்டி பற்றி யாரும் பயப்பட வேணாம். நைட் டியூட்டி கன்ஃபார்ம் ஆகிறதுக்கே நீங்கள் பல பேர்கிட்ட சைன் வாங்கி வார்டன்ட்ட காமிச்சாதான் உங்களை டியூட்டிக்கே விடுவாங்க. கேர்ள்ஸுக்கு ரொம்ப சேஃப் அண்ட் செக்யூரான பிளேஸ். பேரண்ட்ஸ் உங்கள் பொண்ணுங்களை விட்டுட்டு நீங்கள் தைரியமாக இருக்கலாம். பேரண்ட்ஸ் யாரும் கவலைப்பட தேவையில்ல. ஸ்டூடெண்ட்ஸ் நீங்கள் வேணால் ஃபீல் பண்ணிக்கோங்கடா. காலேஜ் வந்ததுக்கப்புறம் என்னடா வாழ்க்கை இது, எக்ஸாமு, அசைன்மெண்ட்டு, ஸ்டடீஸ்னே இருக்குன்னு யாரும் கவலைப்பட வேணாம். நம்ம காலேஜில் தேர்ஸ்டே ஆனாலே போதும், மொத்த க்ரௌடும் சிகப்பிக்கு முன்னாடி வலி மீது விழி வைத்து அந்த டோர் எப்படா திறப்பாங்கன்னு காத்திருப்போம். எதுக்குண்ணா எல்லா தேர்ஸ்டேவும் செட்டிநாடில் மூவி நைட், எக்ஸாம்ஸ் அப்போ இருக்காது, நம்ம அட்ஜஸ்ட் பண்ணி தான் ஆகணும். வாட் எவர், நான் இப்போ சொன்னதை நீங்கள் ஸ்ட்ரிக்ட்னு நினச்சிங்கன்னா ஐ வுட் யூஸ் த வேர்ட் சேஃப்டி. Creating a safe and secure environment which is essential for students to focus on their studies and to reach their full potential, and Chettinad provides that, and they strive not to fail at that task. So on behalf of everyone, I warmly welcome you all to Chettinad Hospital and Research Institute. ஓடவும் முடியாது, ஒளியவும் முடியாது, they will be watching you. Thank you.
Thank you all for sharing your experiences. That was a very energetic and fun-filled session.
A child's earliest memory of a doctor is a person in a white coat, which has served as a preeminent symbol of physicians for over 100 years. The White Coat Ceremony is a rite of passage for medical students and was created by the Arnold P. Gold Foundation in 1993. During the ceremony, a white coat is placed on each student's shoulders and the Hippocratic Oath is recited, signifying their entrance into the medical profession. We will now be having the White Coat Ceremony for the 18th MBBS batch of Chettinad Hospital and Research Institute. We wish to hand over the white coats to every student on stage, but due to time constraints, we will be calling 3 students to represent the batch. We call upon Mahashri K, Dasaraju Sai Shri, and Mrudu Bhashini to come onto the dais and collect their white coats. While they are collecting their coats, we request the freshers among the audience to stand up and wear their coats.
The Hippocratic Oath is the oldest and most widely known treatise on medical ethics. It requires new physicians to swear by numerous healing gods and dictates the duties and responsibilities of the physician while treating patients. The Declaration of Geneva, or the Physician's Pledge, was drafted as a revision of the Hippocratic Oath that could be comprehended and acknowledged in a modern way. It was adopted by the Second General Assembly of the World Medical Association, Geneva, Switzerland in September 1948 and has been amended 5 times since then, the last in 2017, to reflect the changing circumstances and understanding of medical care. I request all the Phase 1 MBBS students to stand in unison and repeat the Physician's Pledge as it is being read out by Dr. S. Nirupa, Professor of Microbiology and Controller of Examinations, CARE.
I request the Phase 1 MBBS students to meaningfully repeat the Physician's Pledge after me. For your convenience, the Physician's Pledge is displayed on the digital screen on the stage. Are you ready? Kindly repeat after me. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. Thank you.
Thank you. Please remain seated.
We now invite Dr. Alice Peace, Associate Professor, Department of Microbiology, to deliver the vote of thanks.
Good morning, all. It is my privilege to propose the vote of thanks on this momentous occasion of the inauguration of the 18th batch of MBBS students on behalf of Chettinad Hospital and Research Institute. Firstly, we thank God Almighty for His grace, which enabled us to organize this memorable ceremony. We thank our Honorable Chairman, Dr. Shri MAMR Muthiah, who is an astounding entrepreneur, a great businessman, a heartful social activist, a futuristic and a visionary educationist who has successfully established high-quality educational institutes and healthcare centers across the state. We thank our beloved Chancellor, Srimati Geetha Muthiah, who is a radiant personality and has been catalyzing the collective efforts in managing this institute. We thank our esteemed chief guest, Dr. V.V. Bashi, an outstanding cardiothoracic surgeon and the director of Institute of Cardiac and Advanced Aortic Disorders, SIMS Vadapalani. Thank you, sir, for accommodating us in your hectic schedule, and your very presence inspires us. And your talk, we believe, would channelize the aspirations of the young budding doctors of tomorrow. We thank our Vice Chancellor, Professor Dr. R. Sridhar, an eminent pulmonologist who is the pillar of support for care through his valuable insights and directions. We thank our advisor care, Professor Dr. T. Balasubramaniam, for being relentless with his consistent support on all occasions, be it academics or research. We thank our registrar, Srimati Jayendra Saraswati, whose astute administrative capabilities have propelled care towards greater success. We thank our dean, Professor Dr. N. Meenakshi, a renowned pulmonologist who has been a pillar of support and whose motivation has been a guiding light for all of us. We thank our Vice Principal, Professor Dr. R. Arun Kumar, whose orchestration of various teams within care has constantly challenged and motivated all of us. We thank the deans of various schools of care, heads of all departments, and all faculty members who have graced this occasion. We thank Dr. Sanjay Theoda, Head, Cardiovascular and Thoracic Surgery, Chettinad Super Speciality Hospital, who made it possible to invite our chief guest and help us partake in this wonderful talk of his, which enriched our experience. We thank all the faculty who helped us organize this memorable occasion. We thank all the students who helped us with the inaugural function. It's with collective respect from all of our hearts that we thank the parents for trusting care with the future of your beloved children at such a critical time of their lives. We assure you that your wards would be trained in discipline, par excellence, and would come out as noteworthy candidates in not only being a professional, but also a responsible and inclusive citizen who would forge a better tomorrow. Last but not the least, I thank all the admin staff, infrastructure team, IT team, security team, transport team, and housekeeping department for their support in having this program organized successfully. Finally, as the saying goes, the future belongs to those who prepare for it today. Gear up for your future. All the very best students, and welcome to the CHRA family. Thank you.
Thank you, ma'am.
We request the gathering to please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. Jai Hind. We request the audience to kindly remain seated till the dignitaries leave the auditorium.
Now, we will be having an orientation session for the Phase 1 MBBS students and their parents, facilitated by the Vice Principal, Chettinad Hospital and Research Institute, Professor Dr. R. Arun Kumar.
Good morning. I am Dr. Arun Kumar, Vice Principal of the Medical College. Before I start, I think I need to thank all the students and parents for choosing our institute to pursue their dream, pursuing their medical undergraduate degree, MBBS. And you can get rest assured that we will put in our heart and soul. We means our team of faculty members, at least 20 to 25 departments. We have nearly 250 to 300 doctors working here. And like I said, we will put in our heart and soul in making your wards successful doctors, physicians, or surgeons, or pediatricians. And I'm very happy that I could speak in front of Mr. Subramaniam, who is the retired general manager of Indian Bank. And he was my first chief executive officer in a pharmaceutical company. And before this, I was working there, and he has come here to see that his daughter-in-law is admitted here, I believe, and his son is a famous orthopedician, Dr. Arumugam. He is an expert in knee transplant, or knee replacement, not transplant. I mean, I've taken the vibe from Dr. Bashi, who is an expert in cardiac transplantation. I request them to, Priya ma'am, the PowerPoint presentation. See, I'm here to give some basic points that everybody wants to know. What is it? This is to avoid some confusion, or what it's going to be like our institute, or what is the name of the medical college here, what is the university which is going to give the degree. Because many times we see that the students and parents, they get little confused in quoting the name of the institute. I would like to say that you are studying medicine in CHRI. CHRI is the name of the medical college here. It is Chetnad Hospital and Research Institute. Unlike, there are institutes which try to adopt different terminologies in calling them. If you could see Madras Medical College, Government Stanley Medical College, Government Keel Park Medical College. We have this terminology which is CHRI, Chettinad Hospital and Research Institute. So you need to say that in which institute you are studying. It is not Chettinad Medical College. It is Chettinad Hospital and Research Institute. And to which university it is affiliated. The hospital itself is deemed to be university, and the university has got the name of CARE, C-A-R-E. Many times in the stage you would have heard that, the Vice Chancellor of CARE, the Registrar of CARE. This CARE is nothing but Chettinad Academy of Research and Education. You would see there on top of it, that is our logo. So the university is Chettinad Academy of Research and Education, of which Chettinad Hospital and Research Institute is a constituent medical college. And you will be getting the degree from the university, Chettinad Academy of Research and Education, because you are pursuing medicine in one of the constituent units of that university, namely CHRI. Now there are, let's say, about 10 or 12 key points that every one of you should know about. I have tried to give, we need to know few things about the campus and about the academics and simulation lab, discipline, how important, how much of stress that we are going to give it to discipline in this campus, research, ragging, fees and hostel and recreation, transport, safety, and we have been talking about next examination. This year it was supposed to happen, but I don't know, maybe definitely you will be a batch which will be taking up next examination to qualify for practicing medicine. And then there are a few other aspects related to transport and MyGate and textbooks and logbooks and record. Every activity, that you do on a day-to-day basis, you need to put it in the record note and logbook, and we'll be distributing at least 8 or 9 logbooks and records as a first-year student. You will have to maintain it, and we will be issuing it later in the stores. And the textbooks, we have arranged the sales of textbooks in Demo Hall 1, which is in the anatomy department of the college block. We have negotiated with the vendor, and we could get at least 35 to 40% reduction from the MRP. And that will benefit all of you, and we have organized the stall. And today, once the orientation is over, you can go there. After lunch, you can buy the books, and then you can, of course, I don't expect you to start reading from tomorrow, but then you need to be committed to, handle those books, maybe every day or, a couple of hours every day. Like you have seen that this is a green campus. We don't permit vehicles inside. We have only battery operated vehicles or bicycles which you can use it. And you have seen that this campus is totally secured. Even the patients cannot enter into the college block for want of safety and security to our students. You have seen that there are many colleges, engineering colleges, arts and science colleges around our campus. And before 10 years or 12 years, we had many of those students venturing into our campus that was actually putting our students into some stress. So we have decided that we need to keep our campus fully secured, and then we started implementing this turnstile, biometric access, and all those protective measures. This is only for your safety and security. So you need to understand that this is meant for your well-being, and we need to have your support in implementing these things. And there is CCTV monitoring inside the campus. More than 500 cameras are there. It is again only to make sure that there is something which is getting monitored. And many campuses, many institutes, many medical institutes and engineering institutes are trying to follow this CCTV monitoring. This is only to tell you that there is a monitoring system by way of having the cameras and the biometric access. And this also helps us to run good academics, meaning that we have occasions where the students, they don't come to the college regularly, or the parents think that their children are in the class attending the classes, but sometimes a very few students, they don't attend. Maybe there are a lot of malls and cinema theaters outside. They think that they are in the college, but some of the students are in those malls and entertainment zones. It is only to avoid that, and we are not against entertainment. We are not against going to malls or celebrating the life or enjoying the life, but there is a time for everything, to make sure that the time that you are spending in the college is absolutely productive to you and the parents, to give an assurance that you are really in the college and attending it. We are having this biometric access. In case if a student is not coming to the college or is not attending a class, they will have the message sent every hour or every class. The parents will get a message. And very soon we'll be introducing facial recognition for attendance. That is again, why we are doing it is that, sometimes our students are innovating more than what we think. They get biometric fingerprints and they give it to their friends, and we think that the attendance is for the student. But one student is giving attendance for 5 of his friends or her friends. And we need to really do a lot of CBA work to see how they are taking or mirroring their fingerprints. They take some dental materials, they take some Fevicol or some glue stick, and then they try to get fingerprint, and we are actually vigilant on these things. I'm not saying everybody is doing it, but there are few students who are doing it, and hence we have decided, I think very soon we'll have a facial attendance for all of us, including first year to final year and including postgraduates. And this is only to make sure that the time that the student is in the campus, they have good academics, and also to give confidence to the parents that we are very serious about their education. Okay. And you know that the course duration is 4.5 years plus 1 year of internship. And first year we need to pass. Unless we pass, then there is a break. We cannot go to the second year like engineering colleges or arts and science colleges. There are no arrear system in the first year. Unless we pass, then we don't see the light of second year. And there will be a supplementary examination in case, if some of us, do not get through in the first attempt, within 1 month or 45 days, we'll conduct another examination, so that there will not be any break batch, and we give ample opportunity for all of you to study well. We give special classes in case if some of you need. In the first 2 months, we will, try to identify, some of you, if in case, if you need special coaching, we'll organize evening 4 to 6 or 4 to 5, we'll have special classes. And hostel entry, like, some of those students were mentioning that it is 6 o'clock in the evening, and after 6 o'clock, we don't permit students to enter the hostel. And students, in case they want to go out, or, first year students for girls, parents or guardians only should take them. We don't send girl students on their own, especially in the first year. Boys, of course, if their parents or guardians authorize, and there are separate processes. Every stakeholder will inform you. Hostel or day scholar. For day scholars, dean's office will inform you in case if you have any doubts, and hostel wardens will help you in sorting it out, how to get out of the campus and then venture into it again. And library, we have 8:30 to 8 p.m. And in case after 6 o'clock you want to study in the library, you need to have a separate permission from the dean. And we'll be checking it. The librarian will be giving attendance for that library attendance. And attendance, I've told, it is biometric. Right now it is based on fingerprint, but very soon we'll have a facial recognition, and attendance is 80% mandatory. For some reason, if you're not having 80% attendance, then we will not permit. Not that we will not. The NMC has said that 80% attendance, if some of you are not having it, you will not be permitted to appear for exams. But we help you in organizing compensatory classes in the evening and other times. If you have attendance of 70 to 75% attendance, if then the attendance is less than 50%, then we need to extend your duration for 1 more year to study. It may be for any reason, for medical reason or non-medical reason or for anything. We are insisting based on NMC recommendation that the attendance is 80%. And internal assessment is nothing but we'll be conducting formatting assessment tests, maybe 4 or 5 in a year, and in any of those tests, we expect that you need to perform by scoring minimum 50%. And consistently, if we are not scoring 50% and the aggregate is, let's say, less than 50%, as per NMC guidelines, then you need to be debarred in appearing for
university examination. So there are two important catch here. One is the attendance, 80% we have, then we'll be permitted to appear for exams. The second criteria is that internal assessment, unless I score 50% aggregate of all those internal assessments, then I will not be permitted to appear for university examinations. I request all of you to take these points seriously, because sometimes the parents or students come with the request that my son or my daughter has scored less attendance. Why don't you give attendance? Attendance is not something that we give from our own hands. I mean, it is all documented, and NMC is taking your attendance every day. We have CCTV monitoring, we have biometric attendance, which is connected to NMC. So they are actually monitoring it, and nobody can touch this attendance or internal assessment marks. And logbooks and records, we want every one of you to write whatever you are doing on a day-to-day basis in the logbook and in the record books. We'll organize guest lectures. We will have evening classes in case if we feel like, some students need additional training or coaching, and we have very strong mentor-mentee program, and you will be divided into various groups, and you will be given, in charge some of the faculty. We have first year faculty, maybe about 40 or 50, and your academics and progress in the academics are, those aspects will be discussed by the mentor with you, and in case if we see that there is a problem, we will contact the mentors, and the office of the dean will contact their parents and guardians, and will keep them updated as well. This is, I think I have for academics, and we have an excellent simulation lab. It is the largest in Southeast Asia, which is accredited by American Heart Association. We are conducting basic life support training and advanced cardiac life support, advanced trauma life support, and basic life support for obstetrics, labor and delivery. And we also have mannequins meant for teaching first year, second year, third year, and fourth year, and you will have opportunity to venture into skills lab and simulation lab to handle the mannequins. Discipline, we know that this is a campus which gives more importance to discipline on par with academics. Unlike many other institutes or many other private medical institutes, and our management and administration is bent upon maintaining discipline in the campus. And we need to respect the patients, teachers, and cadaver. I mean, in anatomy, you will handle cadavers. You need to respect them, and you need to treat them with utmost respect and sincerity. And patients, we need to, why we insist on discipline here with regard to the uniform or the apron or the way we behave with the patients, because, this is a profession which functions based on the communication we make with the patient. The communication is based on the statements that we make, but also the other way of communication is the body language, the dress, the attire, the way that we walk, the way with which we speak with the patients. Everything actually matters here, and unless we maintain some decorum and discipline, the patient will not open up with you. He will not be willing to talk to you, explaining his problem. So we need to build confidence with the patient. That's why we insist that we need to be disciplined. We need to be respecting the patients, because with the patients only we are going to learn. Patients are giving their body for us, their soul for us to learn medicine from them. So we need to understand that we are learning medicine from some human being who is suffering with some disease, and we need to treat them with dignity and respect. And I have told there is a uniform, there is a white coat, and there is a CCTV monitoring, and there is a timing, 8:30 to 4, college will function. There is a designated time for lunch, and then break is given. But we request all of you to utilize the time you are in the campus productively. And research, we try to motivate the students, and every year, right from first year, we are informing, we are training the students to submit proposals with ICMR, and ICMR is going to select 100 to 200 proposals submitted by the undergraduate medical students of India. And every year our students will get about 10 to 15 projects. This year also we had about 8 or 9 students, not just from first year alone, but from every year. The ICMR is going to give us 50,000 rupee, not for us, for the student. And we encourage all of you to get motivated to submit the proposals. And in case if we see that a proposal is good, but then ICMR has not selected it, our institute will fund those research proposals. We will help you, of course, in all these processes. And ragging is very important. I just want to spend some time for ragging. There is the anti-ragging bond. Okay, we will help you. The faculty of first year will help you. The students should sign the anti-ragging bond or agreement, the parents should also sign the agreement, and you all have to upload it in a separate UGC portal. We'll help you to understand all those things in the coming days. But the parents should take a note of it, that parents are equally important in saying or in preventing that ragging is not going to happen in this campus. And we need commitment from the students of first year and the parents of first year. What is the commitment that we are looking for is that please do not engage yourself with any conversation with a senior. He may be known to you already, he may be your school senior, he may be your neighbor, but then our humble request is that do not engage in any way with any of the seniors. That is the starting point of getting into ragging. You may be coming in a college bus, you may be staying in the hostel, you may see some of your seniors in the food court or in the college campus, but we want none of you should be talking to the seniors. We have occasion where a first year student, thinking that it is a friendly, engagement, talking to the seniors, and the friends of the seniors were targeting the students, not only them and all the friends of their first year. Let us not give, any scope or an opportunity for ragging. And we know that ragging is punishable offense, and we do not want such things to happen in our campus. We have anti-ragging duty for all our faculty, including, in the hostel and also in the buses. So don't take it lightly. Okay, any senior who's talking to you, please come to me. I am there in the college office sitting, and anybody can walk into my chamber and can see me. And Priya madam is there, she's a microbiology head, and all our first year HODs are there. And any of you can see any faculty and make a complaint or make a statement or make a representation that so-and-so senior is talking to you. And if we see, we will definitely interfere, because your uniform is different, the uniform of the seniors are different, and we know if there are two different color uniforms are talking there, and we know that there is a senior talking to a junior, and we will interfere. But there are times where we don't see. The faculty may not be witnessing or may not be watching you all the time. So never encourage any senior. You can politely refuse to talk to a senior. And if some senior is trying to talk to you, some senior is trying to, coerce you in engaging with the conversation, please avoid and inform us. And we request the parents also to sensitize your children and alert them that if a senior is talking to you, please inform. It may be a good conversation, but we do not want in the first 3 to 6 months, even a good conversation between you and a senior to happen. We don't want. It actually, if you try to encourage, then it actually spoils the life of the senior. Because we are very strict, we'll suspend them for 3 months summarily. If it is beyond a limit, we'll make a police complaint. We have a disciplinary committee. We have an anti-ragging committee. So if you want to help the seniors, I'm telling you that please do not talk to a senior. This is very important. And fees, I thought I'll give a clarity on this, that we are collecting the fees for only 4.5 years. For your convenience, we have divided the entire fees into 5 equal installments. So please do not have an impression that you are paying fees for the 5 years. No. The entire course fee is divided into 5 equal installments, and then we are requesting for your convenience to pay it in 5 times. And it is only for 4.5 years. And there is a break fees. What is the break fee is that in case, in an unfortunate scenario where a particular student is not able to clear the exams, and because of that, if the course duration is extended instead of 4.5 years to, let's say, 5.5 years or 6 years or 7 years, very, very rarely we see some students. For them, if the course duration is extended, then we will be charging it. And I wish none of you will be in this category to talk about break fees, because we know that you are all good students, you scored good marks in the NEET, and then you will not be in that situation to talk about break fees. And hostel entry time and exit time we have spoken, and then recreation, plenty is there. This is the very same auditorium. You will have the cultural programs and the movies here, and then buses and key routes, you know it, and you can be in touch with the transport department. And MyGate application today for hostelers, it is organized in Lecture Hall 2 after lunch. We request you to go there, only for hostel students, not for day scholars. The parents and students should go to Lecture Hall 2 to register in MyGate, and also to Demo Hall in Anatomy department to collect the books. And next preparation, and like I was saying that we are not eligible to register and practice medicine if we don't clear next. We are going to provide training to clear the next examination right from first year. We have been doing it for the 3 years, 4 years, and you will be the 4th or 5th batch to venture into this next training. and we wish you all the best, and we hope that every one of you should come out with flying colors, and the parents, we give you assurance that we will be very, very serious on educating and providing training to your students, and we only look for your support and the support from students. And with this, I conclude my talk, and I wish every one of you great success in this campus. Thank you very much. And I have a small announcement. I think Mr. Ramaswamy is my student, and I have taken a lot of their help, their volunteers, their students have come forward, and I can see Dr. Priya and Nirupa, they were all contributing for this function, and I thank every one of them for their pain and effort. And with this, I invite Ramaswamy to conclude this session, and he has some instruction to pass to us. Thank you very much.
Thank you, sir.
We request all the Phase 1 MBBS students to join us for a group photo which has been arranged at the entrance of the Sigapi Achi Convention Centre. Following this, you can proceed for lunch.
Lunch has been arranged for the Phase 1 MBBS students and their parents at the food court adjacent to the auditorium. 6 food counters have been arranged in the ground floor and first floor for your convenience. We request you to kindly join for lunch after the photo session. You will be guided by our volunteers. Thank you.